Go ahead.
Okay, so good evening and welcome to the show. This is Your Mental Health Matters. And tonight we'll be talking with Cassandra Barnes, who is a registered nurse and a licensed professional counselor, among other roles, who has years of experience with um, working in the mental health profession. And I am Deborah Wilson. I am a licensed professional counselor, but my primary job is a an assistant professor at a local university. And my role is to train mental health professionals. And so what we're going to talk about tonight is our journey into the profession, why we chose to go into the profession. And we're going to also talk about the mental health crises that's going on in America today. And we can say abroad too, when we start talking about trauma. But just to get started, I think that we'll talk to Cassandra a while and talk about how or what your journey was like into the profession.
Okay, great. Great. So again, my name is Cassandra Barnes. I am the owner of the Victoria Barnes Mental Health and Wellness Center. My primary role is lead therapist and providing a comprehensive approach to mental health wellness. As you stated, I am a registered nurse. I've been a registered nurse since 1988, and I have a plethora of certifications and accommodations and awards related to that professional journey. I was a corporate administrator for the largest healthcare management organization, literally worldwide. And my background is very broad. I also have a business credential from Cornell University.
So when you started out, I think we lost you. Are you there? I think we lost Cassandra.
Well, maybe she'll be right back. If we could continue talking about the journey of mental health, why don't you share your journey?
Okay, well, let's see. I've been in the field for about 30 years now. And my journey began with at a community college. And initially I was going to go into psychology, but life happens. And while I didn't go that route, I ended up having a child. I got married. I moved away. Oh, she's back. So
I apologize. My phone was on Do Not Disturb. I don't know why. I got.
She's working on that a little bit, and we'll let her work on that. She'll be right back. She's working it out. Sometimes those kind of things happen.
Okay.
Can you hear me, Dr. Wilson?
Yes, yes.
Okay.
So to continue with my journey, I completed my 2 years at Wayne County Community College in psychology, and my original dream again was to become a psychologist. And again, life happens, and so had a child, got married, moved around a little bit. And when I finally got a chance to go back to school, computer science was the big deal. So everybody, you should go into this, you should go into that. And so I ended up going into computers as a computer information system analyst. And I worked for an oil company for many years. It was like pulling teeth because that was something I did not like, but it was a lucrative career. And at some point in my journey, I said to myself, okay, let me consider doing what it is that I want to do or have always wanted to do. So I took a job at a university, at an HBC, mind you, and they happened to have a counseling program. Now, while I would have preferred the psychology program, I ended up going into counseling because the psychology program that I applied to said, well, you can't work and be in this program because it takes focus, and it was just a requirement of the program. So the next best thing was counseling, or the next best opportunity for me, most convenient opportunity for me was counseling. Being at an HBCU and around all of these doctors and very accomplished African-American folk who looked like me, it was like, okay, I'm gonna go for it. And before I knew it, I had completed a master's degree in counseling. I had a wonderful advisor who encouraged me to go into the doctoral program, not knowing what I was getting into. I said, well, okay, I'll do it. And I did it because I would encounter him every so often because I did work on campus. And he said, Debbie, I have not seen your application yet. When are you going to put that application in? So I did it. Before I knew it, I had completed the coursework, which was after the master's degree, sort of a piece of cake going through the book work. But it was the process of getting through that doctoral program, which was the challenge. Thankfully, and again, the nurturing environment in which I found myself in allowed me the psychological, social, and other opportunities to actually matriculate through the program.
Okay, I'm excuse myself. Cassandra's back, so I'll continue the conversation.
Okay, and so Cassandra, I'm talking about my journey right now.
Yes.
In the interim, I obtained licensure.
Yes.
And from then, I ended up traveling around the country a little bit. I happened to work in South Carolina for a while, which was to me, one of the best mental health systems that they had. And so that kind of really got me into it, engaging with clients, going through all of the counseling process with engaging with clients and training as it relates to all of the things that I needed to do to make me successful as a therapist. And then I started teaching. I started teaching on the community college level, where I taught both psychology and computer courses. And then from there, that led to my teaching at a university, which was a PWI that I worked for and semi-retired from, but it was such a wonderful experience because as I taught, I always maintained a private practice. Okay.
Yeah.
So once I ended up in Georgia, I opened up a private practice. I taught. I always maintained a private practice because the private practice gave me the opportunity to understand what was going on, not only from a mental health perspective within the community, But also it made me better in terms of teaching. It made me better in the teaching environment. So having that private practice and teaching provided me with a lot of experience so that I could be a better professor in my role of training other mental health professionals.
Yes.
I found that it was a very fulfilling journey because at that particular time, I think the city in which I was in Georgia, I think there was only maybe 2 or 3 African American licensed professional counselors. And by the time I left that teaching position going for another one, there were over 40, I think, African American mental health professionals in the area, which was something that was really needed because when we start talking about barriers to mental health, one of the barriers for African Americans, which was the population that I was interested in, and other marginalized populations, there was a shortage, right?
Yeah.
It was a barrier. Individuals did not want to engage in a therapeutic or counseling process because there were not people there who either looked like them or could relate to them. And so I really enjoyed the journey, and I still enjoy the journey, even in the midst of the crises in which we are facing from a mental health perspective. And we'll get into that a little more if we have time in the show. Okay. So that's a little bit about my journey. One of the things that I also learned, not only through my journey, but through research, is that individuals can benefit from counseling, right? 80%, there's an 80% chance that a person can benefit from therapeutic intervention and counseling than, right? And so with that, I think I'll talk to you. We'll resume our conversation, Cassandra, about your journey into the profession and where you think we are as far as addressing the mental health issues within our community.
Okay, thank you. I do apologize for that glitch where I was kicked out of the Zoom. So I do apologize for that. As I continue, I'll just lay this groundwork because it is relevant to how I ended up in counseling. Because it wasn't actually a decision that I made to go into counseling, and I will explain that later.
Okay.
I was a corporate administrator for the largest healthcare organization worldwide, and my job was to our physicians were my clients, but my job dealt with a lot of other dynamics, to keep it simple. What I had learned along the way, though, was that even when I was working as a nurse where I was dealing with patients, I was doing more counseling in many cases than providing healthcare management per se. So in the midst of what I was doing as a nurse in various capacities, it was like I was always counseling. So my thought process as in the capacity of working as a nurse was, how can I get more training related to counseling? So I thought that a counseling degree was like a 30-hour, a basic 30-hour master's, like other master's programs. And I said, well, I'll just sign up for like a basic counseling to enhance what I'm doing as a nurse in that capacity, not realizing that what I signed up for was a whole professional 60-hour licensure program.
Yes.
And I didn't realize it until I actually got the book. So I didn't have, in all honesty, a thought process to go into counseling because I was a nurse, but I'm a Christian believer. And when I say God ordered my steps, he actually absolutely did. It's nothing in me that would have made a decision to go into counseling. But because my steps are ordered, that was the best decision that I didn't intentionally make per se.
Okay.
And it literally, I could not have chosen a better next career option than what I'm doing. I absolutely am phenomenally fulfilled, phenomenally blessed. My numbers are just off the charts. Like I've had over 4,000 surveys of sessions, and I average between 4.8 and 5-star ratings consistently.
And
so
we-
it shows that God, and I'm leading to answer your question. It shows that God's hand was on it, even though I didn't know to ask for it per se, to ask her. So you asked me about my journey. That's what I'm trying to relate. When you look at what is needed and what makes this very special for me and why I think it was ordained this way is because I'm able to comprehensively bridge the gap between healthcare, mental health management. You asked what's the relevance of mental health management today and where do I see it? I don't see it, and I think this is why my numbers are as phenomenal as they are, because of my background as an RN and understanding how mind, soul, body, spirit. I'm also certified as a Christian counselor as well, and neuro board certified in neuropsychotherapy. How all of these pieces comprehensively fit together.
Right.
So you can have somebody physically healthy, but these other mental background traumas, unhealed wounds.
Right.
We just celebrated Mother's Day. My clients deal with tremendous mother hurt per se, and working through these. So
childhood trauma,
and even childhood traumas that they don't understand are childhood traumas.
right?
Because you can have certain occurrences that's common in families where they don't even recognize it as a trauma in their consciousness, but in their subconscious it's still a trauma, and it's impacting how they are showing up in their everyday life and from their mental perspective. So there's a lot of dynamics connected to where we are today and where we see the decompensation mentally, which is why the suicide rates are off the charts, why the murder suicide, is off the chart, where the domestic violence, sexual bondage and sexual, moving against people in areas of bondage related to sexual issues.
Right. And
So,
thing, and one of the tools that we use in counseling and is the ACEs, right? Where we are looking at childhood factors that could play a role in what's going on with an individual today.
Yes.
Right.
Yes.
And so you're right. When we start talking, and if the one thing that we've learned is and this is besides all of the traumatic events that individuals may go through on a daily basis, when we talk about Katrina and Rita, we talk about Harvey, we talk about COVID, right? If you had a child when you were young, right? This is in addition to any other childhood trauma you may have experienced. And so over time, if those things are not addressed at some point in your developmental journey, these things will come out. And there is where you talked about the neurobiological aspect of the self, in which you deal with, in addition to your counseling training, right? And how all of these pieces come together, giving you a better understanding of the whole individual as
Yeah.
opposed to what may be going on with them right now.
Right.
Uh-huh. So you started out as a RN.
Yes.
You saw what was going on from a client or patient perspective, found yourself doing a lot of therapeutic intervention,
Yes.
interaction with your clients, and based on who you are as a Christian, were led into further investigation into what's going on here, right? How can I better serve the clients that I have this nurturing or this inner urge to engage with? How can I make this a better thing, right? Better,
Yeah.
how can I become better at this? And so that led you into a counseling degree,
Yes.
right? And one thing that I want to say about that, as with your journey from nursing to counseling, or to including formal training in counseling, it gave you a real respect for the counseling profession. That's what
Yes.
I say with my transition from computer information systems into the profession. It gave me a whole different level of respect for individuals who began their journey there for whatever reason. A lot of us go into, and a lot of my students say, okay, well, I experienced this as a child, and this went on in my community, and I feel as if I want to help other people, right? So a lot of people that come into the helping professions come in because of something that they experienced, right? Which is something that I found very fulfilling from a teaching perspective, because I was able to assist them in becoming cognizant of and aware along their journey of how not only did this curriculum assist them, but assist them to better assist others in their journey into the profession.
Yes.
And so understanding who you are is a big part of your success, it sounds like, in the profession.
Yes.
Right? You
Yeah.
said that you are a Christian. Now,
Yeah.
even though there is a Christian counseling program, there's a mental health counseling program, there's a school counseling program, even though we're trained to keep that separately, knowing who we are, and I'm a minister in a church. I work with a women's group. understanding who I am, not only as an African-American woman, but as a Christian, allows me to better interact with clients and within the profession and with trauma and understanding the situation that we're in now that better helps me to facilitate interaction with clients.
Mhm. Mhm.
So I don't know if I got off track or not,
Mm-mm.
but your journey and understanding who you are, I'm sure contributes to the
Absolutely.
high rating that you find yourself in success with clients, you say?
Yes, absolutely. If I can be transparent, the way that I actually approach therapy is significantly different from how I was trained. And I think that probably is more of the reason that my ratings are as stellar as they are. I'm a registered nurse. So the way that and let me just lay a little groundwork so it makes sense with what I mean, because I almost practice as a therapist opposite from how I was trained in my therapy program because of my nursing background, which is primary for me, right?
Okay.
So in healthcare, we are very root cause oriented. We use symptom identification mainly to point us to the root cause. Okay. So we don't do a lot of focus on on symptom manifestation because if, for example, if you come into our office and you have pneumonia, you may or may not have a myriad of symptoms, right? But if we treat the pneumonia, every symptom associated with it for you is going to be eradicated by virtue of us treating the pneumonia. So our focus is identifying root cause. We don't focus on the elevated temp, the shortness of breath, the diarrhea, the weakness, the loss of appetite. We need to know that, but that's not our main focus. Main focus is treating and eradicating the pneumonia that's causing it. Therapists that are trained mainly in therapy focus on symptom analysis. So tell me how you felt when your dog, bit you and you were just trying to love him. Tell me how you feel when your mother did this, or how did you feel? What were your thoughts about it? All of that. And that's great. But I don't spend a lot of time like that, in all honesty.
Okay.
I only want to know the symptoms only to point me to the root cause.
Okay.
I don't do all of these strategies and all of this coping mechanisms because my thought process is not to have you cope with your dysfunctional stressful presentation, but let's heal the root cause so that you don't have to cope with it, that we heal it.
Okay.
So when we look at so you're rarely gonna have clients of mine telling you that I gave them all of these antidotes and strategies to manage dysfunction because I generally don't. Okay. What I generally do this comes just from like I said, I have a ton of education certifications. So all of it works together with how I approach therapy.
Okay.
So the first thing that you have to understand about human beings and how they function, everything that infant, that fetus, that toddler from conception to age 7 has formed the foundation of their subconscious mind.
Okay.
That is the base of who they are. That is their operating system. Their subconscious is like a recorder that bit everything it saw, everything that it felt, everything that it heard, everything that it experienced in the womb, from conception through birth, through the developmental seasons of their life, up to 7 years old, when, if you're progressing in a healthy manner, you start actually processing information at 7. So
is this
everything that was
So is this a psychoanalytic approach that you're talking
no.
about? Okay.
My approach is not psychoanalytic. My approach is that's why I was saying it don't fit into a category that you would pull from as a therapist. Because
Okay.
I do everything opposite from what I was taught. So I don't have that approach. That's what I'm trying to explain. The approach, if you know, if you understand that the way you show up in life is going to 100% come from the way your subconscious mind is, 95% of the way you show up in your life comes from programming in your subconscious mind, period. There's no way around it. Your consciousness only drives 5% of how you show up.
Okay.
So trying to use willpower, this is why you can be in therapy for 5, 10, 15, 20 years, and you're still managing symptoms. This is why the singer Kirk Franklin has been in therapy for 30 years. This is why Jennifer Lewis has been in therapy over 20 years. That's not a compliment to me, even though they boast of that. You know, I've had a therapist for 30 years. I've had a therapist for 20. I've been in therapy for 10, 15, 18. To me, that is not a compliment. That is somebody that has allowed you to master managing symptoms for 30 years.
So tell
My
me this.
thing,
Okay.
I'm sorry.
Go ahead. Go ahead.
My thing as a healthcare professional, I don't want you managing symptoms. I don't want you needing me as a therapist for 20 years to 30 years to help you manage recurring mental health issues that you deal with. So it's just like, as a nurse, when I was working with patients, I would have patients that would go to Sam's or Costco's, and they would buy a bottle of 200 Tylenol, okay? 200 Advil, 200 Aleve or Motrin. And one day the Holy Spirit just put on my mind and said, why do you think they buy 200? It's 100 doses of pain medication per bottle.
Okay.
Mind you, they're going to use that bottle and then they're going to go buy another bottle. That's what I see happening with all of these celebrities and just general people. I have clients that have been in therapy for 10, 15, 20 plus years. So whoever. And what the Holy Spirit revealed to me was, because as long as you're managing symptoms, you're not healing root causes, you're going to be on symptom management protocol. That's what all of these coping mechanisms and strategies and everything that a lot of therapists use do. It's just like Tylenol. You take it and manage it temporarily, and then you're going to be facing it again when the next thing shows up. My clients overwhelmingly are not managing symptoms. They are healed. They no longer need a therapist to help them manage. They may do a check-in. I ask my clients for 4 months to a year. Now I do have clients that have been with me longer, but less than 10% of my clientele have been with me longer than a year and a half.
Okay. So let me ask you this. So you're in private practice.
Absolutely.
Your primary job is a nurse.
I don't work as a nurse anymore. I'm retired. I'm completely 100% private practice as a neuropsychotherapist.
Okay. And so, and when you say neuropsychotherapist, you have an LPC.
I am a board certified LPC. That means I'm LPC. I have an additional lifetime board certification in neuropsychotherapy, which
Okay,
neuropsych deals with brain structure, brain functioning,
okay.
how your nervous system, all of that impact your mental health.
And
Presentation.
what type of clients do you accept into your practice?
I don't do severe psychosis or psychiatric diagnosis, anxiety, depression, stress, grief,
Okay.
relationship,
Okay.
basic clientele.
And why don't you do severe mental health? Is it a,
I don't want to manage it. I did psychiatric nursing while I was working on just like today, someone called me, they had a close person to their family that is eating put a sheetrock off the wall, eating
okay,
the sheetrock. Those are severe psychiatric maladies that that counseling doesn't generally help. Medications rarely manage. You're dealing with it without just being overly spiritual. You're dealing with more demonic issues and different things like that, which is another conversation. But that's just because you're not gonna get just like
more,
you're not gonna get much results
now,
from clients that have severe psychiatric diagnosis.
okay, so just on a practical level, I probably would not accept a person that deals with severe psychosis. Number one is a timing thing for me, and then
Absolutely.
the other thing is from a managed care perspective, insurance companies usually don't pay for long-term care.
Right.
Now, over the course of my practice, and I was in private practice with an actual office where clients came in, where I've worked with clients for a couple of years, but usually it's a family system that I'm working with individuals. And we'll work for a period of time. They'll be okay. They'll come back for a check-in. But when we start talking mental health crises, when we start talking about managed care, there's always a limited number of visits that they will pay for. I do EAP. They'll pay for up to 3 or 6 sessions. Over the course of COVID, they paid for more. But usually, if I have a client that is dealing with psychosis or severe mental illness, then I would then refer them to somebody else. Because I'm not, again, from a time perspective, my primary job is teaching. Like you said, your primary job is your primary focus as a nurse or as you said a neuropsychiatric.
No, I don't work in nursing period anymore. I've retired from nursing already.
Okay.
So I'm strictly private practice, counseling, therapy. That's what I do 100% of the time as it relates to that. Neuropsych is a board certification that allows me to do my job more comprehensively, which is what I was explaining, how that all fit in. So I don't work as a nurse anymore.
Okay.
I'm retired from nursing.
Okay, you did say that. Okay.
Yeah.
All right. So go ahead. I know I interrupted you, but I just wanted to just reiterate your comment that you don't work with severe psychosis.
Yeah, that's what really mainly is not a time issue for me. It's an effectiveness issue for me because again, my background is so comprehensive. I worked as a psychiatric nurse when I was working on my master's. Because I didn't choose to be a therapist, I had no mental health background. So I was working as a nurse. And so I transitioned into psychiatric nursing so that I can get some understanding of it, because it was not a choice that I made consciously. And so I understand long-term psychiatric management of dealing with patients that have that level of psychosis. It's a lot of other dynamics going on that's impacting the clinical picture that you're getting. And so my board certification in neuropsych is actually a PhD level board certification. So the education that was associated with it was way advanced for where I was currently educated. So I had to learn it and learn it well enough to pass the board certification exam. So it just gave me that edge. But the reason why I was allowed to take the course and my board certification is lifetime. And that's for a lot of other reasons. I was granted lifetime certification status by the National Board of Certified Counselors because of the work I did in my master's program. So not only did I make a perfect 100 on my thesis, but I had done a lot of extra work where they gifted me with lifetime board certifications on any certification. So I don't have to ever retest. So that was another gift that was given to me that showed me that the path I was on was truly God ordained. I actually sat for licensure before I finished my master's. So when I was granted that opportunity as well. So when I graduated with my master's, I had already passed my license LPC board exam.
Your NCE.
And so,
Your NCE.
I didn't take the NCE. I did my board certification was through the National Board of Certified Counselors. So it's the
That's you did the National Certified Counselor exam. That's what the NCE is.
I don't know I didn't come from mental health. It was through the National Board of Certified Counselors. Now, if it's NCE, if that's a part of that, maybe. But that's the exam.
So I passed the NCE too. That's the requirement for Texas.
Okay, I didn't do the Texas specific exam. I did the national one that I could have used
so when I became licensed, Texas gave their own exam.
Right. I didn't take the specific.
So when I passed that test, then when I went to Georgia, I had to take the NCE because that was the exam that they used for their counselors. Now, they accepted all of my other credentials, as far as my coursework. Of course, you got to have the master's degree. You got to have completed this coursework, this number of supervision hours post degree, and you have to pass the NCE, which is the National Board of Certified Counselors exam. They are the ones now. I think all 48 states and surrounding territories use the NCE as the exam for licensed professional counselors.
Okay, I didn't use those letters. The letters that that's on my paperwork is NBCC, which is National Board of Certified Counselors. So
National Board for Certified Counselors is the organization.
Okay.
The test that they administer is the NCE, but they have other tests that as the counseling profession evolves, there are other credentials that you could get now. For instance, so I was granted reciprocity in Georgia, but again, because Texas at that time, which was in the 90s,
Mhm.
required that you pass their test. Now
Mhm.
Texas requires the NBCC
Right.
which is the NCE.
Okay. So
So
yeah,
the
that's the one that I passed.
So because you're an LPC, that tells me that you passed the NCE in order to get the LPC.
Yeah. So that exam I had actually was granted permission to sit for before I even graduated with my master's.
Right.
So
Mhm. Yes,
yeah.
I
So,
have students right now who graduated this spring from the university, and some of them took the NCE before they graduated, but
yeah.
they still have to go through the state in order to apply for licensure because the NBCC is an organization that supports